So I'll hand over to Kelly. Kelly has been our rapporteur collecting some of the feedback and compiling some of the next steps that we need to take. What are the key action items? What are the key pointers that we've had? So Kelly, I'll hand over to you. Please take charge.
Thank you, David. Today's session was pretty great, very informative and full of insights. So I'll just list a few things that I noted from the speakers of today. So the first speaker, Evelyn, highlighted very important aspects and a few questions that were addressed. Also provided quite a lot of insight as regards policy making. You'll note that most of the speakers have been mentioning that we include youths in policy making. So I hope any of the policymakers that have joined us through the summit have actually noted that and they'll include them in decision making. We've also been, she also mentioned about accountability, social accountability, which is an important aspect in ensuring that youths actually get the drive to work. Then on sexual health and rights, that was a presentation made by Gideon and a presentation made by Joy. It has been clear that youths actually have a lot of trouble opening up, a lot of trouble sharing their problems, a lot of trouble seeking help. And one of the things that has stood out is creating youth-friendly centers. So I was thinking if we take that specific direction, like could we have a specific center for youth, just and exclusively youth, does not include adults, so that they actually find it easier to go and seek for help. They find it easier to seek for help regarding reproductive health, regarding mental health and all those things. It's also important, it has also been aspects such as teenage pregnancies, HIV/AIDS, and drug abuse. You know, they've been mentioned so much, and I think it's an area that many people are actually taking part in, but you'll notice that a few actions that a few people are taking the action to actually engage the teenagers in rural areas. You'll get that there's a lot of stigma around it. A lot of parents actually hold back in engaging youths and teenagers in these talks. So I think if we really take up that direction, it will be great. Gideon also mentioned about promoting youth talents. I think it's when youths are engaged, it's really hard to hear about these mental cases. Suicide rates, I'm sure, will go low if we engage them in these activities. If we provide funds to procure things such as sanitary towels, things such as condoms, if we have facilities that are providing contraceptives and advice around contraceptives, if we can provide this, then it will be great. Then in areas concerning innovations for health, I think Amadi and Victor are taking a very great initiative. If say Amadi can collaborate with Jean of Kenya Fight the Facts, then you realize that pharmacovigilance is going to be an area of pharmacy that will be greatly addressed. There'll be better care for the patient. The cases of counterfeits will be lower. The cases of adverse reactions will be addressed so easily. So I think it's a very great initiative on Amadi's side. Then Victor mentioned about providing water in rural areas. Although it's an ongoing project, I think if we get people to participate in research, it will be a great initiative. So if we have people in this summit, or you're aware of someone who is specializing in this particular area that will help Victor and his team to push this project forward, then it will be a great initiative. Then finally, on COVID-19 and youth response, Gift and Joshin addressed this area very well. I think we all have to appreciate that you have been in one or two groups that are actively doing the things that have been mentioned. If it's online trainings, if it's classes, if it's short courses that you participated in, if you have started a business, like you can even tag your business in this particular platform if you have started it, so that your initiative moves forward. And I think it has stood out that our mental health is so important during this particular time, that is during the pandemic. So if we take up the activities that Gift has mentioned, such as training, classes, attending classes, engaging with other youths, whether it's virtually or physically, and participating in these community activities, then your mental health should be quite great. Then I think Joshin mentioned about Mathare Roots, where they've been making donations, distributing sanitizers, soaps, and masks, provision of menstrual hygiene, which is a great initiative. Thank you, Jean. Joshin, sorry, for that great initiative. So if we get people to do the same thing, you don't have to be necessarily in Mathare Roots. You can start your own initiative at your community level. If you have the capability to provide sanitizers, soaps, and in this period, then that would be great. I think that's what I have to say for today's session. It was very informative. I hope you will put these things in actions and not just have them as a discussion in a webinar. I'll hand it over back to you, David.
Thank you so much, Kelly. And thank you so much, all the participants, the speakers of the day. So as you are seeing, on my screen, currently we are having the partners that we've had, the organization that we've worked with, and it's a caption of all that has happened from the day that we started. The idea came up, we started working on it early this year before COVID. Then we had to stall a little bit because there were other components that are coming in, which have not happened as much as we wanted them to. And we are hoping to launch them officially in the coming year. And those are some of the things that I want to share with you. So on your far right corner of your screen, you can see HENNET, the Health NGOs Network. So Health NGOs Network is the umbrella body for civil society organizations, CBOs, and NGOs in the country, the civil society movement generally. And their angle is to ensure that most of the work that we do as young people, as communities, civil society groups, and related, get to be captured and streamlined into the policy-making processes within the country, so that there's support that is coming, and we need an enabling policy and government environment that's enabling you to do all that you're doing. We've had a number of presentations from 10 to 12 people over this period that we hear. And all these people are doing amazing work in their different spaces. And this work cannot happen unless we have a conducive environment. And beyond the conducive environment, they need support. In every presentation, there was a key bit. What support do we need? How do we make it happen? And that support can be established when we have a policy environment that's guiding how do we relate as civil society organizations, even with the private sector, and even with the government perspective, where now the government has a responsibility to improve access to healthcare services. It is within the UHC agenda. So how do we ensure the policy systems are aligned to ensure we achieve these ultimate goals? So that is a very critical bit, and that is a very critical contribution that we have HENNET on board. And we are looking towards engaging more and bringing on more perspectives on how we can make these advances. On the bottommost, we have UC 1000. There's a product that I mentioned yesterday. It's the vitamin C, the health supplement at the tonic water, which has vitamin C in it. It is a product that is good for you as an immune booster. If you can afford it, please do buy it. It's between 100 to 200 shillings, depending on where you're buying it and which product you're going for. And there's a question that I missed when my mobile and device was having a challenge yesterday on the sugar content. For the 140 ml UC 1000 health supplement, the content is 20 milligrams of sugar. So it isn't a higher volume of sugar. The sugar levels are controlled. And the benefit of it is that it's sugar, the fructose sugar, not sucrose and all that. And if you understand well, fructose has less risk of those kind of the sugar challenges that we have. It's easily metabolized. It's one of the soluble sugars that we have. So it is a good sugar product. So you can consider it. Available products where I know currently is My Dawa, an online pharmacy platform, and Good Life Pharmacy. Good Life has a number of branches, over 20 at the moment in the country, and they work across the whole of Africa. Even in Nigeria, Rwanda, Uganda, they have outlets, and Tanzania as well. So just to let you know. Phillips Therapeutics, they talked about their product that is in the market now on premature ejaculation. We need to look at how do we use such products. And the most important thing that you need to know, it's not only about getting a product, getting the professional guidance to know it is the right product for you before you take it. And if you do that, the challenges that we are looking at from the Fight the Fakes, Kenya Fight the Fakes, from Amadi talking about pharmacovigilance will not be there as much, because you know you are taking it from a qualified professional, you're using it as recommended, and in case of any challenges, you are reporting through the pharmacovigilance IS system, which is very key. Then we have the youth in action. Young people have a voice, and we have to make our voice be heard. How do you make your voice be heard? By joining platforms as these, where we give young people a platform, we engage as people who see the challenges in our societies, but not only seeing them. We are taking an action to address them. And by taking an action to address them, we share those best practices, which one either inspire someone, encourage another individual where they are, and inform another person on what possibility lies in them, so that we take action and have a concerted agenda moving forward. Then we have Quality Healthcare Kenyan Awards, one of our partner organizations. They celebrate the achievements and the best practices in the market. And they have an award that had actually got closed on 30th November. The coming year, they'll be launching another. It's an annual celebration that normally happens to award the best practices. So when it gets to that, well, make the best of it. RESPEKT is another partner organization. They work on sexual reproductive health. Then the Pharmacy Students Association of Kenya. If you've seen, we have a couple of pharmacy students who are doing amazing projects. Amadi is the current vice president of KEPhSA. We have Jean Kasudi is a member of KEPhSA well as a pharmacy student. Kelly is a pharmacy student. Michelle, I'm a pharmacist by profession. I was mentored and developed through the Pharmacy Students Association of Kenya, and it is an umbrella organization that has been nurturing pharmacy students and pharmacists. So if you're a pharmacy student, get engaged in those platforms. And any other student where you are, get engaged in professional associations at your young age, because these are where you get the insights on what to do, how to do it, and who can guide you along the path. Because if you remember the presentation from Newton yesterday on transformational leadership, what builds you as a person in your journey are the people you interact with and how they open up opportunities for you. And that applies to Kenya Healthcare Student Summit. And then on your far right bottom corner is Planet Wizard Africa. There's a guy that I want to give a moment, just a minute or two. Hezron Munyakin, the founder and the principal at Planet Wizard Africa. He works with us. All the design work that you're seeing here is part of his work. And he's been a critical contribution, and he's the same person who's giving you a reward for the most active people on social media today. So Hezron, just a word before I go to the next bit.
Hello, everyone. Thank you for this opportunity, David. Just like to share a few things about Planet Wizard. And on my screen, you can see, so Planet Wizard, I hope you can hear me. Hello.
Yes, we can.
Yeah, so Planet Wizard is basically
yes, we can see your screen.
Okay, thank you. So Planet Wizard is basically a health media and publishing company. And what we do is create content.
Yes, but your voice is breaking. I don't know if it's only on my end. You guys can confirm for me on your end.
Can you hear me?
Yes, you are loud and clear.
Yes, we can hear you.
Okay, yeah. So Planet Wizard is a health media and publishing company. And what we do is create content for health. And this is basically just to educate people on health. I'm sure all of you have heard that they usually say the health system is built to respond to sick instead of providing healthcare. So what we're doing is educating people on different aspects of healthcare by creating content in form of video and infographics and all that on our social media pages. So far we've done one magazine, and this was just like a trial for this year. And as from next year, we'll be doing an issue bi-monthly. Then we also have a website over there. That's www.pwmafrica.com. We also share different articles and news on health. Yeah, then the other thing is on social media, where our presence is, and this is where we share all our educative materials via Facebook, LinkedIn, Instagram, Twitter, Pinterest, and YouTube. Then also we also do documentaries. So far we're currently working on antimicrobial resistance. We'll be releasing soon. And then next year also we'll be having podcast series. So I'd also like to encourage you to be contributing to the magazine, to share your ideas and articles on health. Our contacts are over there. Then finally, I'd like to thank everyone for joining us in this summit. It's been an honor, and learning from you, it's been a great pleasure. So we also have a reward for those who have been most active on Twitter, and I hope you've seen. We've been following, and we're going to share the results later on. We're still yet to analyze that. So thank you so much again, David, and everyone for joining us.
Okay. Thank you so much, Hezron, for that. So there's just been a question that has been shared on the chat box on the link to the group, the link to the magazine, that is. So I believe that is something that you can share now and even share in the WhatsApp group where we are all together. So just a recap of everything,
yes.
Guys. It has been an amazing session. From yesterday, transformational leadership, knowing why you do what you do, knowing what to do to make that aspiration that you have from the why come to place. And then we have to realize that we are in a world of possibilities. And this world of possibilities, all the solutions and all the challenges that we're facing can be solved by someone within our spaces. So the question is, are we reaching out to them, or are we just staying behind and asking what can happen or the challenges that we're seeing? A very important thing, habits, the power of habits. Then we move to the mental health aspect, where we looked at the challenges is, we look at people from a point of, they have a problem. What's the matter with you? Other than looking at what matters to them. Hello, can you hear me? Hello?
We can hear you.
Okay. Hello. So that is one thing that is very critical. Looking at mental health from a perspective of someone who has a problem, other than someone who has something that is important to them, who needs help in a particular situation. So if we can look at it from that perspective, we would have solved much of the mental health challenges. And there's amazing work that were being done by the two presenters that we had. That was Damian Juma and John Mwangi from Voice of Dago. Then on social accountability, Kenya Fight the Fakes. We've seen the challenges of fake medicines in our product, in our country. Maybe it's you who have used a fake product at any one point in time, especially in the medicine world, or maybe you know someone who has. And because of those issues, it's a matter of us bringing it up as a matter of urgency and looking at how to adopt the solutions that we need to build on place. And I was amazed by the fact that in our WhatsApp group yesterday, there was just a mention of probably people in media can collaborate with Jean from the Kenya Fight the Fakes to do a documentary or cover a story on the impact of fake medicines in the Kenyan market. And that is something that can help us amplify our voices as young people and make advances to make a better world moving forward. Then we move to NCDs, Edward Gonzalo from Stroke Association of Kenya, empowering people to take responsibility and to be individuals who are self-sufficient, independent, rather than beggars who are expecting people to give them handouts and all. And as we get to the final bit of it, the Youth Voices Summit, as I mentioned earlier again, our focus is on amplifying the voices of the young people. And to amplify these voices, we need to identify young people who are doing amazing work in their different communities, empowering themselves and empowering others to ensure we achieve a healthy community, a healthy population. And other than just being healthy, the health voice, we're looking at your general well-being. Because if I'm broke, I'm not healthy. I'm mentally challenged at that point in time. So we need a wholesome being who is socially responsible, constructive, and contributing to their community development. So in that case, we were looking at identifying We give you a platform. From this discussion, as we encourage, let's engage. We have chats, we have social media pages, we have the WhatsApp group that is in place. Let's engage, let's share what we do. Because unless I know what you do, there's no way that I can chip in and support, or I can link you with someone who has somewhere to help. And that is a very important thing. And that mentioned, I'm looking at it from the perspective of Amadi presenting about pharmacovigilance. Who are the people in pharmacovigilance with such a system? The Pharmacy and Poisons Board would be a critical partner to have on board at this point in time. And another consulting organization, PVCC. If we link him to such kind of a platform, there's the possibility of this product seeing the light of day. And that is the power of sharing what you are working on, sharing new ideas, and looking at how to integrate them into systems that are existing and getting support from others. We live in a world of possibilities. You just need to reach out and see where that solution can come for you. Then other than identifying and exposing and sharing such kind of networking platforms, we've noticed that most of our work as young people are challenged because of lack of capacity. And Joyo Gingo mentioned it critically. And in the coming year, we are launching one of our curriculums that we are developing. There will be a training program, 4 modules. We're looking at personal competencies, interpersonal, social competencies, and then we have the managerial competencies and even leadership competencies. Do you know how to mobilize resources for your initiatives? And when I talk about resources, it's not only the money. And that is a resource that you need to get to make things drive to where you need them to get to. Aspects on emotional intelligence. How do you bring people on board? How do you manage your own time and ensure you organize around the things that you're doing? So there will be a training program that will be launched. We'll get in touch. We have your emails in case we didn't get your email or you just logged in directly from your phone. You can reach us on email at info.ryculture@gmail.com. Text any of us, and let's move forward together. And at the end of the day, we'll have made a difference, knowing that as young people, we have a role to play. And other than complaining, we are playing it, knowing the ultimate end goal of what we wish for ourselves and for our communities. Asanteni sana. It has been a pleasure, and have a great afternoon.